Good morning, Dr. Bird here again. Today I would like to discuss an interesting case that came across my clinic not long ago. One of my patients experienced sharp pain in her intercostal, in her left side of her rib cage, and the patient thought it was a heart attack, even though the patient was relatively young. And the patient went to the emergency room. They did all kinds of scans, blood work, blah blah blah. Nothing was discovered. So just let her go home and said you're fine. And then the patient came to my office a week later and says I still experience this pain. So I did the proper testing and diagnosis, and I figured out that she had an intercostal nerve impingement that kind of when this nerve is being irritated, being pulled, it shoots across your entire rib cage, if you can see it like here, and goes all the way to the back, and kind of mimics the symptoms of the heart attack. So the intercostal nerve, so just to give you an idea, you can go from the back. It starts at the spine, goes in between each rib, in between the muscle, and I mean goes in under each rib. There is like intercostal groove, and this nerve goes all the way around. It kind of like lets you know if one of your ribs is broken. It lets you know that there is an issue. So, but sometimes when your vertebra is out here, oops. The upper extremity, just when the vertebra is out and the rib is not articulating properly, it will pull this nerve and will create this problem. So what did we do with this patient? When we did the diagnostic, her T6 vertebra was completely out of the place, and when the patient was inhaling and exhaling, the rib during these processes it rotates. So it allows the expansion and contraction of the rib cage to allow air in and out. As a result, this rib wasn't articulating properly when the patient was breathing. And so what we did, we adjusted the T6 and we adjusted the rib cage. And then obviously we did some interferential stimulation along the rib cage to relax the muscle, because the muscles between each rib, there is a small there are muscles that allow these ribs to move during the breathing process. So we did that, and after 3 sessions, the patient felt better, and the symptoms are completely gone. So if anybody thinks that they have heart attack or persistent pain with these kind of symptoms, feel free to contact us, and we'll be able to help. Doesn't mean that it's a rib, it could be some other problems, but proper diagnosis and treatment will give the results right away. Because if you don't get any results right away, the problem will continue to persist, and the patient will still have problem. So all right, well, that's about it. Like and subscribe if you think this information is valuable. Have a good day.